being much more confident in getting your own views out there, in putting yourself forward, in making early collaborations. Strange really, because I'd left school and I'd gone to college to do business studies. And it was whilst I was doing business studies, I realised that actually to think of a future in an office was really not within my being able to do, if you like, within my personality, in terms of what I was gaining from it. And it was one of the girls that was on the course that says that she was applying for nursing. And up to that point, it had never crossed my mind. She applied for nursing, and I thought, I might give this a go. Wasn't much out there in terms of media programs or anything like that at that time. There was just one program, and I remember it really quite clearly. It was called Angels, and that was the only program that was on about nursing. And I remember being quite interested in that. So when she said that, I thought, I think that's something I could possibly do. And once I qualified, I decided to go into paediatric nursing, because that was one of the placements I enjoyed most during the training. Stayed within paediatrics and really worked my way up in terms of experience and skills within paediatric settings. The area of work I'm in now is still within the area of paediatrics, so children and young people's care. And I've recently appointed a consultant nurse position within the organisation at Manchester Foundation Trust for Transition of Care. My biggest career challenge today has to be the role I've recently been appointed to. And the reason I say that is because it's a new role for the organisation. It's a clinical academic role. So in terms of following in a footprint that's been there before, that doesn't exist. In terms of visibility within an organisation, really puts me there. And that's probably something I'm still not quite comfortable with. But in terms of the connections and the opportunities it presents, both clinically and from a research perspective, again, aspirations are really quite high, my own and the organisation's. In terms of how others see me, sometimes makes me laugh actually, because they might say that I'm really quite scary, and I think, so that often takes me and makes me smile. And really being part of a team and being able to share with colleagues, what works well, and actually sometimes what doesn't work well, and what you've said or you think you've come across as, and just being part of a whole, really. I think probably when I was doing my PhD was probably a low point at times. It was quite a lonely journey in terms of the academic side of the work of a PhD. That wasn't really something that was at the time supported within the organisation I was working within. So as it was felt that it wasn't a requirement in which the job I was doing, so therefore why would I do it? So in terms of that support, that wasn't there. And without support in research and being able to talk that through with others, then that makes for quite a lonely, isolating place to be. So that was probably one of the loneliest places to be at the time. I never really considered giving up the PhD at that time. Not only was I invested in it, but also the participants involved in the study had already given so much of their time, had already given me their narratives and their stories. It wouldn't have been right to ever consider giving up. It would be wrong not to say my best supporters have been my family throughout it all. Even at the times when it was low, they were there constantly as a source of support. To deliver on something different, to be able to get teams on board, both clinically and academically, to be able to drive that whole research agenda for nurses, midwives and allied health professionals, and be part of creating something new and creating something different. I want to really succeed in my job. I would certainly say to myself, be much more confident in getting your own views out there, in putting yourself forward, in making early collaborations, working with other people in terms of sharing expertise, gaining expertise. Be bold, be confident. It's not a weakness to ask for help. There are plenty of people out there now that can help you on that journey. It's okay to try things and it not work out. So I think for me, it's very much about supporting those that are now coming forward, who now think or are considering a research career in health or in social care. It's around nurturing that interest. It's about supporting them to develop to the next stage, whatever that may be and whatever that might look like. Historically, when we talk about research, it's generally been males that have been driving the research. And so to support the women to get there, I think it's something we should all be doing.